half the children will die before the age of 8 due to inadequate healthcare, lack of clean water. Simply put, our mission is to carry hope to the children of the Himalayas. MountainChild started 21 years ago, built out of honestly tragedy. Back when our founder actually went on a trekking adventure to the Himalayas. He and his team were resting at a tea hut, and two gentlemen came walking down the mountain with about 30 children. They had, large stomachs because they had intestinal worms. Their hair was matted. Some of the kids weren't even wearing shoes. And the man just openly admitted that he was taking these children to Kathmandu to ultimately to sell into the brothels of Mumbai and other places in India and even within Nepal itself. So if you were to ask him, about that moment, he would describe it as just a sledgehammer hitting his heart. So MountainChild is focused in on 5 core issues. We focus in on health, education, human trafficking, child labor, and the environment. So we build schools, health posts. Typically, we serve about 40 to 50,000 individuals every year through these variety of initiatives. We serve patients that have basic cuts to life-threatening traumas. Our scope starts where the road ends. And so we have to trek sometimes 7 to 20 days to access villages and villagers that we're serving.
My experience, it's not a trail that we can trek easily like in the US, but it's very vulnerable, risky, it's scary trail to go from one village to another village. It's so complicated.
So HALO stands for Health Airlift Operation. And it officially started in December of 2018. So we have partnerships with a helicopter company that allows for us to get a helicopter into the remote area very quickly. Once the helicopter gets up there and picks up the patient then is brought to a hospital, and we have a partnership with a major hospital in Kathmandu called Medicity.
They're so happy, and during that moment, I feel heavenly. It's a great blessing.
We are so grateful for Jackson Healthcare and just their heart and willingness to not only make a difference in the lives of people that they're serving and people here in the United States, but also to make a tangible difference in the world. They've been a huge supporter and partner with us in HALO. And so there are opportunities for medical professionals and individuals to come and serve alongside us and with us in the Himalayas. And then here stateside, we have actually a volunteer program that mobilizes a volunteer base. And so we all play a part in, I believe, making a difference in the world.